The World Health Organization says the number of people dying of starvation in Gaza is growing. The UN's aid chief is warning that the coming days will be make or break for humanitarian efforts as Israel begins 10-hour military pauses to allow aid to be delivered.
Look, yesterday was a start. It's a drop in the ocean of what's needed. During the ceasefire, for those 42 days, we were getting in 600, 700 trucks a day. Yesterday, it was fewer than 100.
Israel, along with Jordan and the UAE, resumed plane drops of supplies yesterday. That is something aid groups have criticized in the past as ineffective and dangerous, all while the humanitarian situation worsens. Sana Beg is the executive director of Doctors Without Borders Canada and joins us now. Sana, good day to you.
Thank you. Nice being here.
Well, I'm glad to have you, just for your expertise in particular. You heard the UN's aid chief there, Tom Fletcher, saying that the aid that's gone in during these past pauses has been basically a drop in the ocean relative to the need. How would you describe the situation in Gaza now?
Well, to describe the situation now, you really have to look back at the last 2 years of this devastating man-made engineered crisis, where we've seen nearly 2 years of engineered moments of micro breakdowns that are now resulting in a macro collapse on several fronts, as it relates to humanitarian aid, as it relates to mental health, as it relates to the entire ecosystem that people in Gaza rely on for their daily survival. You're absolutely right to point out that we are one of at least 100 or so credible international humanitarian aid organizations that are critiquing the provision of airdrops into Gaza. This is a mere distraction, as we have seen many of over the course of what we're seeing unfolding in the occupied Palestinian territories. You have the roads that exist. You have hundreds, if not thousands, of trucks lined up literally just outside of Gaza on the Rafah crossing, waiting to enter with the amount that is needed to make a dent in the needs, the caloric intake that is required of the Palestinian people at this stage today. You have to understand what we were putting in when the last time there was a brief momentary pause. To be able to get in 500 trucks or so at that moment was sufficient to meet the needs of populations. Today, you have to understand we will have to now deal with people that have been dealing with prolonged durations of being malnourished. And so to be able to carefully refeed them back, to be able to rehabilitate them back and do that in a careful, sustainable way is going to require another gargantuan exercise.
Why does the UN call this week make or break?
I'm sorry?
Why does the United Nations call this week make or break when it comes to the food, the hunger crisis in Gaza?
Well, quite simply, we're at a tipping point, aren't we? You are seeing disturbing images of skeletal babies in the arms of their mothers who are malnourished themselves and cannot breastfeed their children. You're seeing children in that critical phase of the first 100 days of their lives being severely, acutely malnourished. That is going to have lifelong consequences if sustainable, accurate amounts of the food that is required and the supplies that are needed to reach these populations is not met in the next couple of days, if not today, immediately, you will see mass starvation and mass deaths by starvation.
So when you have a plane, which can't carry as much as a convoy of trucks, but when you have a plane that drops a pallet of food, or you get 100 trucks in instead of 700 or 800 trucks, what kind of difference are you making on the ground?
We've long been saying that any sort of a mechanism that is outside of letting trucks in, the amount that we need in, is merely going to be a trickle in the vast ocean of needs that exist in Gaza. You cannot, for one, control the quality or the volume of food that you can bring in via airdrops in comparison to 2,000 tons or more that you can get in through road transport into Gaza. The second situation that you have to consider is that these airdrops can happen in locations that are not in the specified green zone. So it can very well lead to a chaotic situation, a survival for the fittest, where people will have to scramble, as we have seen in other cases before as well, scramble to get handful of aid that is clearly never going to meet the needs of the vast majority of people that need that aid.
In short, if I...
And I can tell you as well, what our teams are seeing on the ground, the impossible choices that we have to make. We have Canadian staff that work in Gaza today, and my colleagues that are there have been telling us about the difficult choices we have to make on a regular basis. We have to choose between who to give highly nutritious food to. We have to decide who is quote unquote malnourished enough to be able to receive that aid. Heartbreaking choices that no one should have to make.
Do you get to a point where, and this sounds very callous as I'm going to say it, do you get to a point where the level of hunger is so great, the level of malnourishment is so great, that you would choose somebody who is in better shape?
I can tell you that there is a real moral injury that our staff are dealing with every day. Choices such as the one that you're portraying here, in addition to the multitude of other choices we've had to make. Look, our staff as MSF, alongside others in the aid sector that are working tirelessly in Gaza, they haven't had food in days. They struggle themselves while providing life-saving care to find one meal a day. And is that meal nutritious? Is that able to meet the daily nutrient requirements that you need? Very likely no. And they're making those difficult choices on hungry stomachs and trying to save lives on a daily basis. So do difficult choices have to be made? Absolutely, on a near daily basis.
What are you looking for from the international community? Because we saw last week a couple of dozen countries, Canada included, saying this has to open up, Israel has to open up, there has to be more food going in. You've also seen the United States come back today and just reject the two-state solution conference, not even a two-state solution, but the conference that's underway right now. What are you calling for the international community to do, and what is realistic to call upon them to do?
Well, isn't it realistic to denounce international humanitarian law violations as Canada has done? And it's time for those words to be backed up with action. So an immediate ceasefire, of course, we have been calling for that for 2 years now. But we need to also be able to have real conversations about how to impose real consequences on Israel, either as Canada or in partnership with other governments and actors. And also from a Canadian perspective, ensure that no Canadian arms trade is being used to fuel war crimes. Those are our specific asks to the Canadian government, and Canada has a long history of being a real player in international humanitarian law and on the global stage. And we're asking for that legacy to speak for itself and for actions to be backed by the Canadian government today.
Sana Beg, thank you very much for your time today.
Thank you for having me.
Sana Beg is the Executive Director of Doctors Without Borders.